Welcome to Zoe EPCR Basic Training. To get started, we will log into our iPad. Once logged into the iPad, you'll see an app named RMZ. Tap that icon. When the app opens, it automatically updates the most recent version of the app and syncs all new data. A select user screen is now at the center. Tap the Search Users bar and begin typing your name. Your name will be auto-populated, and then you can select it. Once you have selected your name, tap the Login button on the bottom of the window. A new login window will open with fillable bars. Select the unit bar and begin typing in your unit, and when it auto-populates, select it and tap Done. It will then prompt you to create a new password. This password will be created personally by each user and will not need to be periodically changed. Once you have logged in successfully, a Select Crew window will appear. This is where you may add any other crew members that will be with you on a call or shift. Tap the All Users button and then use the Search Users bar to find your partner. If you need to add more crew members, on the top right of the Select Crew window, there's a plus button. Tap that button and search for the crew member to be added. You are now brought to your incident inbox. Think of your inbox like your inbox on ESO, where you pull up your catted calls. From here, you will be able to do many things. Your calls will auto-populate here, and you can create calls here. You can edit calls and change your crew if needed. Let's start with a practice call. On the lower portion of the window, tap on the icon labeled Practice. This will create a practice ticket. You'll now have a window that has gray sections down the left-hand side of the window with a selection of icons at the bottom of the screen. For now, we'll focus on the gray sections. The best way to complete these reports is to start at the top of the gray sections and work your way down. The reason that it is best to do it this way is because as you go from the top to the bottom, depending on selections you make, the program may add or subtract fields that you may need or may no longer need to complete. So let's get started. The first section is labeled Start Here. This is where you'll select your company, Universal, and where you can see any dispatch notes that may have been provided from the dispatch CAD. Since this is a practice ticket, we don't have any dispatch notes or imported CAD information. The next section is labeled EMS System. Here you'll choose your home post, the EMS system ticket type, and outcome of care. Most of these boxes are pretty well defined and can be completed without much instruction. To the right of the bars, you'll notice buttons that can be tapped. Those are the quick touch buttons. They are some of the most common choices for each particular field and can be tapped to add instead of searching through the fields themselves. Here's where you can see your selections affecting the number of gray fields on the side of the report. If you choose Cancel Call, then you'll see already that some fields are being taken away because they are no longer necessary. If you go further and choose Cancel Prior to Arrival at Scene in the Outcome field, you'll see on your gray sections that the majority of sections have been subtracted because there is less information required for this ticket type. We'll do a patient encounter ticket type and patient transport outcome so we can complete a common report. As you move along through the reporting software, you'll notice red circular icons with an exclamation point in the middle. These represent missing information that is required to complete the call. Think of these as your closed call rules. Your report will not be able to be validated and completed until all of the exclamation icons are gone. On to the incident section. All sections with a red exclamation on the icon will need to be completed. As with all sections, please fill out as many fields as possible, as the more information we have, the better the report will be. As we go, we'll see a field for location name. Once selected, you'll see another search bar. You can search for facilities many different ways. The call time section is a self-explanatory section, so we're not going to waste any time here. The patient section is where we really start to see some of the great benefits to the Zoe program. Once you get to this section, you'll see a patient demographics page. Here you can fill in any information manually, or if available, you can scan or photograph the patient's ID to fill the fields. You'll scan the barcode on the back of the ID, and it will autofill a lot of the patient demographics information. As you scroll down, you'll see the signature info fields, and then the closest relative guardian guarantor fields. Moving on to the patient history section, you'll see areas for history, medication lists, allergies, and the patient's physician. You can take a picture of the patient's advanced directives, such as DNRs, or post forms and also their medication lists. If you choose yes under medication lists, the program will assume you are going to take a picture of the list. By doing so, it removes the patient's medication section from the left side of the screen. If you are not able to take a picture of the list, select no, and then you'll be able to complete the medications in the patient's medication section. The patient's medication section will be only available to you if you choose no under patient medication lists. This is where you'll add any medication that your patient reports taking. If you do not see the medications you need, you can add your own medications by tapping the blue plus button on the top right corner of the screen and adding the medication. On to the complaint section. Here you'll choose your patient's primary complaint and secondary complaint. You can use the quick pick buttons on the screen surface, a complaint bar, or even add your own custom complaint by tapping the blue plus on the top right of the screen. You'll see different categories of complaints at the top of the screen. Going on next to the section with the HPI, or History of Present Illness. Here you'll find fields for symptoms, onset, and activity, provider impressions, and whether or not this was a work-related injury. As a side note, if the patient has an injury or rash or any signs, you can take a picture of it in the location field in order to have a better representation of the site. Selecting yes in possible injury field will populate a new section titled Injury, which can then be completed with more information about the injury, including diagrams. The Vitals section is where you will need to enter a new set of vitals. Tap New. It will give you the option of importing from the monitor or adding your own. We will talk about importing vitals later. For now, let's look at adding some vitals. All of the vitals required will be accompanied by the exclamation icon. Complete all fields that you can, and certainly all required fields. By this time, you have probably gotten the hang of all the prompts and the way to add in values, so we'll skip through going through each field. Now we have completed one set of vitals, but still have an exclamation icon. There always needs to be at least 2 sets of vitals. Tap New again to add another set. Once your second set is complete, you've met all the minimum vital requirements. The next section will be the assessment. Be sure to complete all fields you can in the assessment section. You can add as many assessments as you need for your patient. Moving on to treatments. Tap the Add button to add any treatments that were performed during the care of the patient. Treatments are synonymous with interventions. If you notice any treatments missing, please inform a manager so we can have them added. Moving on to the narrative section. This section is pretty self-explanatory, but there are a few different options. You can type on the iPad keyboard, use a Bluetooth keyboard, or even use the iPad's talk-to-text function. Once you have completed your thorough narrative, we'll continue on to the outcomes section. The outcomes section has transport details, destination, follow-up, transfer of care, and the protocols used during the call. Your next section is the signature section. For the patient we are using on this call, we will get the patient's signature, the receiving facility signature, and all crew member signatures. The names of patient and the crew members will automatically populate, but you'll have to tap the blue plus icon to add the name of the accepting nurse or provider. The signature section will indicate what signatures are needed on any call, by placing the red exclamation icon next to all required signatures. This next section is the billing section. Here you'll take pictures of any face sheets and PCS forms. If necessary, you can even take photos of the patient's belongings. The last section is the reference section. This is a section that will contain information useful to your call, but will not ever need to be completed. Look here for information on algorithms, protocols, or appendices. You can also reach this section by tapping the protocols icon in the row of action icons on the bottom of the screen. The other action buttons are Summary, Docs, Actions, Messages, Call Times, View Photos, ZoiMeds, and Transfer. We will not be using all of these action icons, but we'll go through the ones that we will use. The Summary icon will give you the times and a basic summary of your PCR. Docs will let you pull up a picture of your face sheet, PCR, and CMN form. The Actions buttons will allow you to validate, import CAD data, fill out narcotics form, translate text, and utilize a scratch pad. Call Times just brings you back to the call time section of your report. View Photos lets you see all photos that will be sent with the report that you are working on. The ZoiMeds button brings you back to the medication section of the report. We already talked about the protocols action icon, and the last action icon is the transfer icon. This is where you can transfer the PCR to any other unit, user, or agency. Now that your report is completed and all of the red exclamation icons are gone, we're ready to submit the report. Tap the Actions button on the bottom of the screen. Then you'll tap Validate. It will ask you if you'd like to mark the ticket as complete. And if you're finished with your report and have nothing else to add, then tap Yes. We can still do some things with our ticket even though we've submitted it. We can still send it to a facility. Tap the Docs button next to our report, tap the Patient Care Report button. Now at the top of the screen, you can tap the Send button. This will give you the options to send a fax, an email, or AirPrint to an AirPrint capable printer. This concludes our basic training with the Zoi PCR program. If you have any questions, please reach out and we'll help you. Thank you for listening.